My name is Dr. Katie, and I am a pelvic floor physical therapist as well as the owner of ATL Pelvic Health. We are a pelvic floor specialty practice located here in Atlanta, Georgia. And today I want to go over a couple of different ways that we can improve hip internal rotation. Hip internal rotation is really important to open up the pelvic outlet for vaginal birth. And typically we find that a lot of our patients are more limited in their hip internal rotation. So here's a couple of different exercises that we do with them to help improve that mobility. So first we can do a cat-cow. I like to start with a regular cat-cow. So your knees are right underneath your hips and your feet are in line with your knees. So your legs are parallel. And we can start with just a nice deep breath in, let the stomach drop down, reach the gaze forward, and then exhale. You can scoop and round. And then inhale as you lengthen. And then exhale, scoop and round. One way that we can start to bias this towards internal rotation is you can actually open your feet out wide so that your knees are closer together, feet are open. So we're creating more space on the back side of the pelvis, again, to open up that pelvic outlet a bit more. And then you can move through your same cat-cow, inhaling as you reach your chest forward in space. Exhaling, gaze drops down towards your belly button, rounding your spine up towards the ceiling. Inhaling, reach forward. And then exhale as you round. You may feel a little bit more restricted in this position versus your normal cat-cow. And that's okay. You can then come through neutral. So find that neutral spine position, and then you can just do some gentle rock back. So you can rock back in space, and then shift your hips forward, rocking back, and then shifting your hips forward. A couple of other favorites to help prepare our hips and pelvis into some more hip internal rotation. You can take a yoga block of a variety of sizes. So if your yoga block is a little bit thicker, this might be a little bit more challenging. So we have a couple of different size yoga blocks in our clinic. You can see how one is a little bit shorter than the other. Knowing that I have a little bit of a tighter or more restricted hip internal rotation, I'm going to use the shorter one for today. And you're going to place that block underneath one of your knees, like so. Hands are going to come back into that all fours position. So you're going to be in all fours. Hands are going to be right underneath your shoulders. You're going to have one knee directly underneath your hip on the yoga block. The opposite knee is going to hover in space. You're then going to reach and tap your knee that's hovering down towards the mat and then lift back up towards the ceiling. So it's a tap and a lift up. Continuing to breathe here. Letting your pelvis shift so that the leg that's on the yoga block is having to shift into some hip internal rotation. And then we can do that on the other side. So you can see I just slide the yoga block over, place that knee on top of the yoga block. My opposite knee is going to start in that hovered position, and then I'm going to drop down and lift up. Great. So the last thing I like to do for some hip internal and external rotation is come into what we call a 90-90 or a Z-sit position. So we want your front leg to be a 90-degree angle, your back leg to also be in a 90-degree angle. So my front left leg is into some hip external rotation. My right leg is in hip internal rotation. I'm going to reach my use my glutes to kind of push the front of my hips forward. And then I'm going to sink down, trying to get my sit bone to touch the mat. And so it's a reach forward with the glutes, opening up the front of the hips, and then reaching down and back. So you can do this on both sides. So you can switch to the other side, bringing both legs again into that 90 degree. This time my right leg is externally rotated, my left leg is internally rotated. And I'm going to reach that hip forward, thinking about squeezing my glutes to push my hip forward, opening up the front, and then sinking down, just like that. So from here, you can also do a couple of different things. Depending how far along you are in pregnancy, your belly does start to get in the way a little bit. So if you have really great hip mobility, you can do this without your hands, where you lift your legs up and then windshield wiper them to the other side. For some people, especially as their belly continues to grow in the third trimester, it feels better to actually just reach the hands behind you and do a little bit of a windshield wiper forward and back. Again, this is going to really help open up the hips and the pelvis. It is normal to feel like you're moving a little bit on the mat as you go. But this will also help to improve some of that hip mobility.